What's it to do with? I saw some doctor being commented on from Sky.
Yeah, so basically it's time to every doctor that's not a consultant is a junior doctor because we're still in training in our specialties. And it's time to renegotiate our contract, and there's basically been a big dispute between us and the government over the terms of that contract. And one of the main issues is the government has this kind of agenda that they want a fully working 7-day NHS, not just emergency services over the weekend, which I don't think any doctor disputes would be great, but it's about what we can afford to do with the amount of people that we have. And one of the big things that they're trying to do is cut premium pay for working out of hours. So working nights and weekends, you earn more than working during a normal day. And the reason that we have that is so that hospitals can't force us to work too many in a row, because it becomes too expensive, but it's like a protective measure. And what they want to do is cut that premium pay, and the reason they want to do that is so that they can make us work more of these out-of-hours shifts to cover this 7-day NHS. The problem with that is that even if you make us work more hours, there's still the same number of doctors and you're trying to increase the services, and we're already pretty stretched as it is, so the math doesn't really add up. And from our point of view, we feel like we're either going to be made to work so many shifts that we basically don't get enough time to relax, to sleep, to be able to be healthy, functioning doctors, but also we're going to be looking after so many patients without enough support, because they're just going to try and stretch us so thin that we're not going to be able to make safe decisions and treat patients how we've been trained to treat them, because we just have to be practical and do a half job because we're so stretched. So they've basically been threatening to impose a contract on us for the last couple of months, which is why it's now come to the point where we're striking. So we're all doctors at Watford General. An emergency cover is being provided today, but we've chosen to walk out to try and say to the government that we really don't think it's safe for us or for patients. So that's kind of the bare bones of it.
Yeah, do you think they're trying to, the Conservative government are trying to do anything to work it towards privatisation then?
The more pessimistic side of me does, yes. I mean, in a way, it's not really party specific. This is the biggest issue now, and it is this government trying to push this on us. But whether it was Labour or Conservative, we'd still be feeling the same. You can't make so many people, if you need this many people as doctors for this many patients, you can't then make that same number of doctors work for so many more patients and still be safe.
Yeah. So they're trying to rewrite you a new contract.
Yeah.
Yeah. To work longer hours.
Yeah, and we're not happy with it.
As if you don't work long enough hours as it is.